Welcome to Slocum Center for Orthopedics and Sports Medicine. My name is Dr. Denise Routhier, and I specialize in non-surgical, musculoskeletal, and sports medicine. In this video, we will be discussing compartment testing and chronic exertional compartment syndrome. Chronic exertional compartment syndrome is an unusual condition in which athletes experience exercise-induced pain, swelling, tightness, and occasionally numbness in the muscles. Pain often starts after a specific distance or intensity with exercises and progresses to the point where you may have to stop the activity due to pain. Symptoms tend to improve within several minutes of rest and are usually not noticeable with day-to-day activities. It most commonly involves the lower legs and is seen in competitive athletes. We usually see this in long-distance runners, but can see it with any sport, including basketball, soccer players, and even ballet. Compartment syndrome occurs due to elevated pressure within a muscle compartment. Most of our muscles are nicely bundled into separate compartments by a connective tissue called fascia. I often have patients imagine a piece of steak wrapped up in saran wrap. The steak is the muscle and the saran wrap is the fascia. When we exercise, our muscles expand due to increased blood flow. In some athletes, the fascia, or the saran wrap, is too tight and does not allow the normal expansion of the muscle. This can cause higher pressure in the muscle belly, which leads to decreased blood flow. This results in pain and the symptoms patients experience with compartment syndrome. The best way to diagnose compartment syndrome is to actually measure the pressure within the muscle. This is done with compartment testing. Compartment testing is a special test I perform here at Slocum. The test involves placing a needle which is connected to a pressure gauge into the muscle belly. We numb up the skin with a local anesthetic, then insert the needle into the muscle to measure the pressure at rest. I then have the patient run on a treadmill or do whatever exercise reproduces their pain. Once the pain occurs, we repeat the pressure testing at 1 minute and 5 minutes after exercise. High muscle pressures at rest and significantly elevated pressures after exercise help make the diagnosis. No special preparation is necessary. Patients just need to come dressed comfortably in shorts and tennis shoes with the expectation that they're going to be working out. We will often try at least one round of physical therapy to address any flexibility, strength, or biomechanical issues which may contribute to compartment syndrome. If compartment testing reveals elevated pressures and the athlete has ongoing pain, a fasciotomy can be performed surgically to cut the tight fascia and relieve the pressure on the muscle.